Hi Carla, my name is Levi. I'll be your student physical therapist for today.
Hi.
How are you doing today?
Pretty good.
So what brings you in?
Just really bad low back pain.
Okay, so tell me about that. When does it hurt?
Like when I bend over or anything, like when I brush my teeth.
Okay. So is there a time of day that it's worse or a time of day that it's better?
Morning hurts, I think, more, yeah.
Okay. But especially with like bending motions, you said it hurts the most? Okay. Is there anything that makes it feel better?
I think when yeah, when I'm resting.
Okay.
Yeah.
Now, do you have, with your low back pain, do you feel any pain going down your leg at all?
No.
Nothing like that? No numbness, tingling, anything like that? Okay, great. Okay, this might seem like a weird question, but do you have any odd changes in your bowel movements, in your bladder? Do you have difficulty peeing or starting or stopping peeing?
No.
Okay, great. Wonderful. So on a scale of 1 to 10, what would you say is the best and what would you say is the worst?
Of my pain?
Your pain, yeah.
I think the best when I'm resting.
Yeah.
It doesn't really hurt when I'm resting
at
all.
And what's the worst it gets?
Maybe a 7.
Okay. So 7 out of 10 is worst, and that's kind of when you're leaning over.
I feel like I kind of get stuck. When I get stuck, I can't bend over anymore, and then all of a sudden I can bend a lot, but it gets stuck, and so I think at that point it hurts the most, and then after that it comes down a little.
And how does it feel coming back up?
Same thing.
Okay.
Yeah.
How would you describe generally your flexibility? Do you consider yourself generally a flexible person, or do you consider yourself not super flexible?
I don't really think about it. I guess probably flexible, yeah.
Okay. Great. Let's do just a couple of tests. I'm just going to have you go through some basic motions, and then from there we'll kind of figure out exactly what's going on. So first we're going to start by I want to see how you move. I want to see you I know that might hurt, but I want to see you go forward and then put your hands on the back of your thigh and bend backwards.
Okay. So hands on the back of my thigh.
So start just going down, trying to touch your toes. And how does that feel?
It hurts.
It hurts? Okay, now let's go back up.
And this one?
Yeah, so first come back up. And that hurts as well? Okay, and now just gonna reach back try to touch the back of your knees. Any pain there?
Yeah.
Okay, good, you sound great. So now what we're gonna do is I'm gonna have you lay down on your back, and then we're going to do a single leg raise. So just bring this leg up as high as you can on your own. Any pain there?
No.
Okay, good. Some good mobility. It looks like a lot of that was coming from your low back. Next, what we're going to do is I'm going to passively go through and test that hamstring mobility. So I want you to try to keep your hips straight, try to keep these just nice and we're not super flexible there. Okay, great. Next, what we're going to do is I'm going to have you go onto your hands and knees, and we're going to just kind of go back towards your hips, or you're going to go and try to touch your ankles. So good right there. And now what I want you to do is I'm going to touch your hips and just guide you back. Okay. Good. So a lot of movement in your low back and a little bit of movement in your upper back and in your hips. Okay, so now what I want you to do is just lay down flat on the floor and just bring this leg up and try to touch my hand. And keep your whole leg straight, and bring your whole leg up. So I'm going to help passively go through, and then I want you to do it on your own. Okay? So I want you to come up that way. And then let me know if that hurts your low back. Keep going. Okay, good. Does that hurt? Okay, let's do the other leg as well. Just bring it up. Pain there? Okay. Now, next, what we're gonna do is I'm gonna have you. I'm actually gonna test your hip flexor flexibility from this position. So I'm just going to bring your hip up, and that's kind of tight. So what I would like to do in a different situation is have you on a table, and we do what's called the Thomas test, and I just have you scoot mostly halfway off the table and just let your leg hang, and I'd like to see that hip flexibility there, but given these circumstances, I'm going to adapt and just test your hip flexibility that way. So now what we're gonna do is I'm gonna do some joint play on your back and just see how these different vertebrae of your spine feel. Okay, so first I'm gonna start right here in your low back. All right, there's a lot of movement there. How does that feel?
It hurts, yeah.
Okay. Now up here. Yeah, not a lot of movement there. Great. Now what we're going to do is we're going to pretend to do what's called the prone instability test. Because we don't have a table, we're going to just come over here to the edge of the couch. And if we were on a treatment table, what we would do is have you put your arms on the edge of the table and your back on the table, and I would do the same joint play. I'd push on your spine to feel how movable that is. Still moving a lot, and does that hurt?
Yeah.
Okay. Now what I want you to do is grab onto the edge of the table and lift your legs completely off the table. So you could just pretend with one leg. And now I'm going to do the same thing. And how does your pain feel there?
It doesn't hurt.
Great. Awesome. Okay. So let's come back to center. You can sit back down. So based on what we've talked about, some of the tests that I've done, I'm going to defer from doing a neuro screen. There's no really sign that there's any nerve issues going on, which is a great thing for you. So I'm going to defer from doing any called our dermatome test. It doesn't feel necessary at this point. What I would like to do is I would do some vitals. I test your blood pressure just because I know that you've said that your intake report, you've had some different conditions with your heart. So I just want to have a baseline to make sure that as we go through your treatment, that I can keep an eye on your heart and make sure that we're keeping you nice and safe. So really, your low back is just pretty mobile. So what we want to do is just kind of strengthen that up, get your core really nice and controlled and strong. So you've got a little bit of, you're very mobile, which is great, in your low back, but we want to just make sure that you got great muscles to keep that flexibility safe. And then your hips and your upper spine are a little bit tight, and so what we're going to do is we're just going to help those get a little bit more mobile so that all of that motion when you're doing things like bending, like picking up your dog or brushing your teeth in the morning, that you've got more of that motion coming from your hips and not just all your low back doing all of the work.
Okay.
How does that sound?
Okay.
Awesome. Thank you, Carla.